Dementia is an overall term used to describe symptoms that affect memory, language, communication, problem-solving skills, judgment, capacity to learn, and the ability to perform daily activities. It affects older people but is not a normal part of aging. Because of its progressive nature, the effect is seen not only on the patient but also in his family and career as well. Although there is decline in cognitive function, consciousness is not impaired. However, deterioration in emotional control and social behavior may be observed. Dementia has three major stages: early, middle, and late. The early stage is often overlooked because the onset is gradual. Patient may be in his 40s or 50s who usually forgets recent conversations, repeating the same questions in a short period of time, loses track of the time, day and date, becomes lost in familiar places, has reduced concentration, misplaces items, forgets his password or names of characters in a TV show, and is unwilling to try new things. During the middle stage, signs and symptoms become clearer and are more restricting. The patient will manifest with more pronounced forgetfulness or confusion, wherein even recent events are forgotten, more frequent episodes of becoming lost, increased difficulty with communication, behavior changes such as increased aggression, agitation, and irritability, problems with sleep, even to the point of confusing day and night, delusions, hallucinations, and anxiety, and forgetting names of loved ones, which is very painful for us family members. In the final or late stage dementia, there is near total dependence and inactivity. The patient now becomes unaware of time and place, challenged in terms of recognizing relatives and friends, aggressive, restless, and may even have angry outbursts due to confusion. He becomes incontinent, less mobile since he will already have difficulty walking, less eager to eat since he finds it difficult to eat and swallow, and less conversant since there is already loss of speech. How does one diagnose dementia in a loved one? Many professional or legitimate tests are available in the medical clinics, such as Fallstein Mini Mental State Examination, Neurobehavioral Cognitive Status Exam, and Geriatric Depression Scale Score. There are lab tests also needed so that other conditions may be ruled out. These include complete blood count, chemistry panel, serum neoplastic panel to check for cancers, CSF analysis to check for infection, CSF immunoglobulin, CSF phosphor tau level, and CSF amyloid beta. At home, we can try a mini mental state exam to check if our loved ones have it or may be starting to. Remember though, that the total score you get does not give finality to the diagnosis of dementia. The suspicion will strengthen, but your loved ones will still need to undergo tests by the professionals. Here are the tasks though. To check for orientation, ask your loved one the following: year, date, day, month, and time. These are 5 points. Ask what country he is in, city, part of the city, house number, and street name. These are another 5 points. To check for registration, ask your loved one to repeat 3 objects you named. For example, apple, candle, dress. He should be able to repeat the names fast. Each item he remembers gets a point for a total of 3 points. To check for attention, ask your loved one to spell the word world backwards. This is 5 points. To check for recall, Ask your loved one to repeat the 3 objects you mentioned earlier. This gets 3 points. To check for language, show your loved one a watch and ask him to name it. 1 point. Show a pencil and ask him to name it. Another point. To check for repetition, ask your loved one to repeat no ifs, and, or buts. 1 point. To check for complex commands, write, close your eyes on a piece of paper, then ask your loved one to read it and follow the command. 1 point. Ask your loved one to write a sentence. 1 point. Ask him to copy a figure, say a diamond or a square. 1 point. Ask your loved one which his dominant hand is, then ask him to get a piece of paper from your hand using his non-dominant hand. 1 point. Ask your loved one to fold the paper in half. 1 point. Finally, ask your loved one to put the paper on the floor if you can. 1 point. All in all, there are 30 points. The scoring is as follows. A score of equal or more than 24 points means no cognitive impairment. Between 19 and 23, mild cognitive impairment is possible. Between 10 and 18 points, moderate cognitive impairment is likely, and a score of less than 10 means severe cognitive impairment. Please take into consideration your loved one's level of education, language preference, or if he has any disability, such as dyslexia or stroke, that may nullify the test. Another very important diagnostic tool is a brain MRI. This will show atrophy of many parts of the brain. Not all of the brain are affected by dementia. The usual pathology is seen in the amygdala, hippocampus, cerebellum, prefrontal cortex, and the temporal lobe, although other lobes are affected as well. There is no cure for dementia, but some medicines may retard its progression. These are the cholinesterase inhibitors such as donezepil, galantamine, and rivastigmine, NMDA antagonists such as memantine, and disease-modifying monoclonal antibodies such as lecanemab, which targets amyloid accumulation. Very, very unfortunately, patients with dementia usually die within 8 to 10 years from diagnosis. There is a lot more to read about dementia. This short lecture is just the icing on the cake. Should you wish to know more about it and the other diseases of the brain and the spinal cord, please feel free to contact our team. Aside from anatomy, physiology, and tools to proper diagnosis and treatment of brain diseases, our book comprehensively discusses topics like headaches, migraine, seizures, stroke, meningitis, encephalitis, cerebral palsy, traumatic brain injury, sleep disorders, brain tumors, movement disorders, neurocutaneous disorders, degenerative disorders, post-infectious neurologic disorders, cerebellar disorders, lesions of the spinal cord, and many, many more. Happy reading!